One, I want to thank Dr. Bell for joining us. We met her through actually Dr. Jeff Horowitz, which is a friend, started with sleep. John will tell the story. But really, we brought you guys, you guys are doing something awesome with Dinks. The only problem I had with Dinks is one day I get a phone call, I'm on a webinar, and Jeff says, Ronnie, you're doing it on Wednesday, it's my day. I said, Jeff, I love you. I've been doing webinars before you, but I love you so much, I'll give you Wednesday. So,
very sweet.
You guys are doing something awesome. It's fun. It's one of the first dental groups on Facebook that I really enjoy going there, reading stuff. It's all full of love, friendship, no ego. And I think that's the group who you are, you, Chad, and Jeff.
Yeah.
And I think when people are good, they don't need to show off and they don't need to take people down. And your group, I told it to Jeff, it's just fun. I recommend all our clients, all the people that are on our group, to join you guys every week. It's something else and it's just awesome. So I appreciate you joining us. I know you and John are going to talk about dental sleep medicine, about education, why do these webinars, why even join Dinks? You guys are almost, I think you're 5,000 already.
I was going to say, I thought I saw a celebration for 5,000 dentist members now, right?
That's right.
I remember when they were like 100 and Jeff said, Ronnie, send up an email blast. Come on, send an email blast to have people join.
Even if it's your mom, we don't care. Just tell her to come be a part.
just join and grow the group. But you know what, for us, again, we moved us to another day. Again, Jeff did so much for me personally in this dental community that, I can't, there's not enough that I could do for him. So, I appreciate him a lot. You, a friend, an SGS client. Chad doesn't want to spend money, but I'm sure when he see you guys' success all the time,
that's right.
He'll join the party. But really, thanks for joining us. And I'm going to a board meeting here, so I'm not going to be here the whole time. But John, be nice.
Always.
She handles Jeff and Chad. So
I was going to say she takes their crap. I'm nothing.
All right. So I appreciate it. I'll put my Facebook so I can see you guys. And thanks a lot.
Thanks, Ronnie.
Thanks, Ronnie. All right, guys. I think we got everybody. Yeah, we got everybody in here. Well, thank you all for joining for another evening of Sleep TV. We're gonna keep things brief as we try to on these webinars, just to, I know everyone's busy and to have a few minutes of time just to talk about an interesting subject and maybe raise some awareness about dental sleep medicine and sleep disordered breathing and why it's such an important thing to be involved in, I think is a huge thing. So thank you guys for a few minutes of your time here on Tuesday night. I want to thank Dr. Bell for joining us. The last time I was on a webinar with you, I think we're on the other one. We're on Dinks. I was sitting there without power, running on a generator.
That's right.
In the dark with my laptop, hoping it wouldn't die, drinking bourbon, talking about I don't even know what, but it was fun. We had a good time.
That wouldn't be the weirdest one we've done.
That wouldn't be the weirdest thing that's happened on your.
Yeah, exactly.
Well, I like to, I think, start out, and I've got a few things to cover, but I'd love to hear, Dr. Bell, your story on, what's been your journey into dental sleep medicine?
Yeah.
Where to start and where are things now and all that.
Yeah. So as Ronnie mentioned, I am good friends with Jeff Horowitz, and he's a great dental sleep medicine doctor in South Carolina, also a great friend and a good educator, and has educated for you guys for a long time. And he and I have known each other through the AGD for many years, going on over a decade. And he really encouraged me to attend one of his master track courses that he was teaching here in Raleigh. And that was a 2-day course where we did home sleep tests and, the full dial in on what sleep medicine really looked like. And it was already a subject I was intrigued and wanted to understand more, recognizing our responsibility in screening and detecting sleep issues. And honestly, giving me more data to help answer and educate patients when I knew something was going on, but I couldn't quite articulate it, and I didn't have enough education to put all the pieces together. And after attending Jeff's course, a lot of those pieces started to come together for me. So I became an SGS client at that meeting because I liked the predictability of what was being offered through technology. And that was in 2017, I think. So went actually down to Miami and did another deep dive course with you all at your facility to learn more about the technology itself, better screening techniques, all the paperwork, intake for patients, et cetera. And we became super passionate sleep educators in our practice. We are not a primary sleep practice. We are a general practice, which means we're educated enough to handle what comes in and deal with what patients present with. So we're not specifically looking for sleep patients. We're just specifically looking to screen patients for sleep conditions and then offer treatment modalities. And I honestly refer as many patients out for sleep tests and CPAP machines as we do for treatment in the office, because at the end of the day, it's just educating and encouraging them to do something about some of the things that we're seeing, whether they're paying me or not. I just want them to be motivated to do something. So that's been kind of my journey. And then, you know, I have the good fortune of being a good friend with Jeff. And so he and I are continuing to grow and develop that relationship in sleep medicine. But, you know, now we've been doing it for 5-6 years, and it's gone well, fairly predictable. We have a good system in place, and, you know, this is not a commercial, and, you know, but for me, the SGS technology made it a very predictable and easy transition. And any colleague that I've talked to that was thinking about dental sleep medicine, it was very easy to encourage them. Number one, your education, I think, is a phenomenal entry point for anyone interested in sleep medicine, period. And the second piece of that is wanting to get predictability when you make these devices, because it costs a lot of money doing long titration visits over and over again. And so being able to use technology to help you get a pretty good guesstimate on where you want to end up has made sleep dentistry far more predictable in our office. So I'm happy to answer any questions about what that onboarding process looks like, and to help people feel more comfortable with the idea of sleep medicine. But, you know, I'm not some rock star sleep dentist in Raleigh doing 1,000 sleep appliances a year. Just staying educated about the field and having good informative conversations about patients has really made me a much more competent clinician all around.
Yeah. And I think, you had so many good points in there, but I think the general message too of just, look, you don't have to be the sleep only guy,
Yeah.
like Jeff, where he's doing, I don't say he's not sleep only, but he does a lot more sleep than, you know, it's a much bigger portion of his practice than yours, and that's okay. There's different levels to this, right? Mm-hmm. And I think just being competent and being able to help people. We were just talking, you know, prior to going live here, and I had seen a poll I thought was super interesting a couple of weeks ago in one of the DSM groups, and it was, they were looking at new dentists, and I know I'm looking at some of the people here, and I see some of you are new and some of you are established, you know, sleep practices. But they were looking at new dentists and you know, what's your fear? What are you afraid of? What's holding you back from getting involved in sleep medicine? And it was interesting seeing some of the replies, concerns around, you know, tooth movement and TMJ complications, concerns around having to kind of go outside of my dental bubble in my little office, and now I have to work with a sleep physician, and I got to go communicate with the primary care, and that's kind of a scary thing. Concerns around getting team buy-in, which I thought was interesting, you know, and I say I think it's interesting, but I don't know how many times I've seen that too, where it's, you know, the kind of the doctor solo trying to get involved in something, and the team's kind of holding them back, or just going to what's comfortable and what's normal. So that's always been a big thing in our education, is trying to make it a whole office approach, a whole team approach. And it's funny, you talked about the courses. and we're still doing them. The courses are still happening. Obviously, with COVID, the whole concept of seminars changed, and it's really, it's come full circle and it's come back around. But I'm still not seeing the huge groups that we used to see, at all these different events and even the bigger trade shows. And we're all on Zooms all the darn time now, and that's just kind of normal. But also, what we've done to kind of not pivot away from that, but do something a little more boutique and a little more one-on-one is because the team is so important. And it was a struggle sometimes having a doctor alone come to a seminar, right? And now you go back to your practice and you're like, okay, guys, Monday morning huddle, we're doing sleep apnea. And everyone's like, oh crap, she went to a seminar, she learned all this stuff. I don't want to do any of that. No. Okay, Dr. Bell, we're going to do sleep apnea. And then, right.
They had your card and then all goes away. Yeah.
2 days later, we're right back in the business as usual, and we don't have to do it and talk about it. And so, it's not, that's just the team's fears. It's all this kind of fear-based mentality, fear of the unknown, fear of extra work, fear of who knows what. And so what we've been doing lately, and it's been received extremely well, is more like one-on-one type stuff. So if we have a practice that's truly interested in bringing a sleep program on, whether you want to build a sleep business and really ramp it up and make it a meaningful, substantial, significant part of what you do, or you simply want to be educated and knowledgeable about airway and sleep disordered breathing and how that's impacting your patients, how it's impacting your other dental work that you're really even thinking about as it relates to sleep, and simply just how it's impacting so many of your patients that are coming in every day. And you want to be a good traffic cop and you want to be able to direct people the right way. We can help regardless of what your goal is there. So we're doing more in office, more one-on-one, where an educator comes in and spends a day with a team. That's working out phenomenal. So that's kind of been a shift in our plan over, in recent years anyway, or this recent last year.
I think that's true for a lot. I've talked to a couple of different folks that were professional lecturers for a really long time or in the vendor space, and they're all seeing an educational shift. And we as business owners are having to be more creative about how we continue to get the word out. But you can never underestimate the value of the peer-to-peer encouragement to get them. And honestly, the most valuable sales tactic I've ever seen was the home sleep test. You give it to a handful of humans and then they come back the next day and half of them have sleep apnea. And they're looking at you going, you have to figure this out now because you've now diagnosed me with sleep apnea. So that seems to be an incredibly effective tool at helping people understand, number one, the prevalence of sleep-related issues in our population currently, but what our role needs to be and be able to service and meet those patients directly.
Yeah. It's definitely one of those, one of those funny things where once you pull back the curtain and you start doing some of this stuff and the home sleep testing and the different things, it is remarkable that you could take that home sleep test and almost just blindly hand it out. I mean, you really would, if you did absolutely nothing, literally, you put all your patients' names in a hat and every day you picked a different name. Once per week, you would be diagnosing somebody with full-blown diagnosable, insurance-covered, necessary treatment, obstructive sleep apnea. Yep. That's if you did no screening, no paper, not one questionnaire, literally just picking, them alphabetically. That's kind of, how big this really is. And we were talking again before we came on about, why I see people all the time and they say, oh, I don't see sleep patients, or I don't do this. And it's like, yes, you do. Whether you want to or not, everybody listening to me here saw a sleep patient today. Every single one, right? Every single one of you is going to see a sleep patient tomorrow. Saying you don't do sleep or don't see sleep apnea patients is, it's not possible. It'd be like in dental saying, tomorrow I'm going to see nobody with perio. Well, yeah, you are. It's just what happens, and the same thing with sleep. It's,
I like what you said too, if you just gave it out blindly. And, there's a lot to be said about, I think that there is a stigma or a general stereotype of who the typical sleep apnea patient is. And then when you start digging a little bit deeper, you have the right screening tools or mechanisms in place, that the blinders start coming off a lot, and really open your eyes to the fact that there are a lot of patients in your practice that are suffering from sleep related issues that wouldn't fit that description at all. And a lot of pediatric patients that fit that description, that you're seeing other types of presentations, and you're having the first conversation with a mom that she's ever had about the fact that her child may have a sleep related issue. And you're seeing all the warning signs are all present there. And honestly, John, some of the most meaningful conversations that I have in my practice is when I have a real heart-to-heart with a mom, particularly about some screening things that I'm seeing that could mean nothing, but could be an indication of a sleep-related issue. Or we're pre-screening a patient before they're headed to ortho, and they're looking at me going, should I extract 4 pre's or no? What do you think, doc? And I'm thinking, expand, expand, expand. I don't want you to collapse this airway. I said, I don't care about what this child looks like today. I care about how they're breathing 30 years from now. And we want to set them up for success. And they're so appreciative because no one's really having that type of conversation. So, for clinicians that are watching tonight, whether you treat sleep or not, having informed conversations with your patients about sleep and what our role is in preparing the airway for success from early infancy all the way up to, their last day on earth, having those informed conversations and being confident about that information and giving them reassurance. Because a lot of times their gut instinct is spot on. They know something's wrong, but they can't get anyone to validate their concerns. Those are patients for life. And that's how you build a practice, is engaging those folks in that conversation.
And how much goodwill does that buy you? Even if you're not, you're not involved in the treatment, likely it's going to be, an ENT and ortho and, functional appliances. But if you're the one that connects the dots, identifies the airway issue, pairs that to growth and development and behavior and school performance and all these little red flags that are going off and, in mom and dad's mind, it's, that buys you unlimited goodwill.
Absolutely. Absolutely. And they send your kids to you, and, they send their neighbors and everybody else to you. So, again, I think it goes back to, you don't have to treat sleep, but I think as clinicians and as professionals operating in the airway every day, we have to understand it, and we have to be okay having that conversation. And also okay that it doesn't always translate into a direct prescripted ROI. Like I can say that conversation awarded me a $1,200 crown, or, whatever. Sometimes it's just general care and concern for your community members and making sure that they're well. And again, that goodwill, there's just no way to put a value on what you're doing for your community.
Sure. And, I think the level of involvement you're talking about here is really, it's necessary across the board. And that's, for those of you that haven't seen, the ADA came out with some guidelines and some recommendations, it's kind of a position statement around dental sleep medicine and sleep apnea, which is really good for a couple reasons. One, it really cemented a good, clear policy where it didn't say every dentist has to make sleep appliances and do home sleep testing and diagnose all that. They didn't say that. It just said, you have to be aware. You have to be aware of how airway is impacting your patients. You should be at bare minimum, a good traffic cop and be able to do, what Jennifer just said, in terms of identify red flags, and redirect them. And if you do nothing but that, you decide you're not going to make the sleep appliances and you're not going to be involved in therapy at all, you're going to save lives every single year you do this. That's it. I mean, that's why, that's my why. you know, I've been doing this 20 years now, and it's, you know, for me, it's the cases that people send, right? It's the email I get on a Monday, and they're like, oh my God, look at this guy. You know, I found this case, and it's this skinny little guy with a tiny neck, and nobody would ever thought he had apnea, but he really does, and he's super bad. And, you know, he's in his 50s, and he already had a heart attack, and he's on multiple medications for hypertension and this, and he's, you know, and nobody's connected the dots, you know, because he wasn't 400 pounds with a big neck, right?
Right.
So including the primary care docs, including the cardiologist, including, you know, nobody, there's such this, you know, this stereotype tied to it, but really, you know, he had, you know, a craniofacial deficiency and a retrognathic mandible and a class 2 profile, and you know, that compromised airway. Maybe he had bad ortho when he was younger.
Yeah.
Who knows? But it's, you know, I love those. And when people find that stuff and share it, it's like, you know, you figured it out for that guy. And, you know, it's going to change the course of his life. It's going to, you know, it's going to extend it, but it's going to make the years that are left better. You know, you're not going to be chronically fatigued and exhausted. And so for me, you know, we talk about fears, and, you know, we were, you know, talking about side effects and fears about, you know, your team, how they're going to receive it, or fears about medical billing. Oh gosh, that was the number one. That was it. I'm choosing, it just blows my mind. I'm choosing to not help my patients, right? The people that are coming in tomorrow that have this, I'm not going to do it because I'm scared of billing medical insurance. For real? Like that's why you're afraid to have a conversation. It blows my mind, especially when we, you know, again, it's this whole stigma tied to that, but, you know, we're not talking about, you know, these huge high dollar cash cases. No. You're afraid of medical insurance? All right, don't bill medical. Do it fee for service, right? Who cares? No. We're talking a couple grand. It's not, you know, it's a couple crowns. It's not like $40,000, you know, it's not some crazy case. And
but I even took in-house billing to, like, we do our own medical billing. I use a very inexpensive practice like EHR and do it that way. It's the same 4 or 5 codes every time. Like, billing a crown is more difficult, and I've sent more narratives and explanations for why I decided to do a crown versus a sleep test or a, you know, or a sleep appliance. So it's the same. The thing is, it is a repeatable function. If you say, this is what we're going to do, it's a repeatable function over and over and over. I will not negate the fact that there's a learning curve when it comes to in-network and out-of-network and how all of those nuances work. But there's ways to train your staff and your team members to be comfortable with that conversation and to expect the worst and be happy when that doesn't materialize itself. But that's it. That is one of the challenges for sure, but it is more of a workaround, I think, than most people. I tried the third-party groups, and this is not a knock on any third-party group. It just wasn't for me. It didn't go quite as smoothly as I had hoped. So we just do it in-house. And again, it's a repeatable function. So if your team is comfortable submitting a claim and an EHR for dental services, it's the same process in a medical EHR as well.
And, you know, we have a software we use in our program, and that's it. I mean, it's repeatable. And I was,
and when I tell you it's inexpensive, it's inexpensive.
Yeah.
The cost of a couple, you know, packages of toilet paper for the month.
It's not rocket science. Look, the first time you did anything in your practice, think back to the very first time you were gonna, you know, you billed for anything, or just any procedure, the notes and the, you know, everything you had to supply. It was confusing. It was scary. You probably did it completely wrong. You know, that's okay. You know, it's how it is. And the nice thing with sleep is what you said. It's extremely repeatable. You know, when we compare sleep to other things in dental that you can do, where there's all these different, you know, schools of thought, both clinically and then administratively too, of how you do it and how you bill and how you don't, and this and that, you know, and each case presents its own unique kind of question marks. you know, with sleep, it's very, very cookie cutter. It's the same exact diagnosis code
Absolutely.
every time. I know what it is now before we even started because there's only one, right? And that's it. That's the code. And it's the same treatment procedure every time. And it's the same, you know, ancillary, you know, the additional stuff, the office visits and exams and tests and pharyngometers and x-rays, all that, same codes every time. And so, yeah, the first one's going to be tricky because it's just uncomfortable. It's new. The second one will be the same as the first one, still might be tricky, but eventually, you know, 6 or 8 or 10 down the line, you're like, wait a second, it's the same notes, the same appointments, the same codes, the same fees. It's very much the same each time.
Yeah.
And, you know, you become comfortable and your team does as well. And it just works. But, you know,
Well, and if you happen to be in a community, I found in meeting with other sleep doctors, sleep physicians, they really want a couple, you know, competent dental community members that they can lean in on, because they do need solutions for folks who are either CPAP intolerant or want alternative therapies or want to help monitor those patients long term. So, you know, I found most of them that I met with were incredibly open to, number one, having you come and observe and watch their sleep testing mechanisms to understand better what that really looks like and what patients are going through. So you can have those more educated conversations with patients, but two, just having someone they can refer sleep appliances to. And especially in smaller communities, boy, that is, I don't want to say fishing in a barrel, but it might just be, because if you're the competent doctor in your community that understands sleep well in a small town where a sleep physician needs someone to lean in on, you know, I think that was a big piece of Jeff's success. He's in a smaller community in Myrtle Beach outside of, and he got really good and comfortable with those doctors, and they built a really nice relationship. And out of that came a phenomenal practice of referral basis to and from. And honestly, we have these conversations that are uncompensated, by the way, about diabetes, hypertension, and all the other things we're screening for when they come into our practice. Sleep is no different. And if you just want to look at it from a healthcare provider, we're already doing all of those things included as part of a limited or comprehensive exam or periodic exam. That's kind of an all-encompassing conversation. If you want to make it a more productive conversation, then you start to lean in on those opportunities that you can either refer, you know, your patient to a sleep doctor for further evaluation, or they're ready because they've already been evaluated and wanted an alternative because they're currently not using anything. So it's just leaning in on that conversation just a little bit more to find out if there's an opportunity to help.
Mm-hmm. Yeah, it's right there in front of a lot of you, you know, whether you realize it or not, it's there. And, you know, I grabbed a couple of these images here just to make the point of, you know, look, it's not, you know, your fears about medical, your fears about your team, your fears about physician networks and that stuff, that's all, you know, that's all easy to overcome. And, you know, what you can't overcome is, you know, the 55-year-old patient that dies in his sleep from a heart attack and, you know, or the onset and increased severity of dementia and Alzheimer's, you know, which is very, very intimately linked to the presence of sleep apnea. Or the, you know, the stroke that could have been avoided had we managed the sleep disordered breathing and you know, fix the endothelial dysfunction and the cardiovascular disease that leads up to all these events. You know, it's there. It's there, and we see it all the time. We saw last week the football player. It didn't say sleep apnea, but I'm willing to bet anybody on here $1,000 if you want to take my bet. But I guarantee they're going to come out and say it was sleep apnea in the next couple of weeks. Tony Siragusa, right? He's 55, died in his sleep. He's a big dude, right? He's a big guy, big neck football player. You know, I didn't see sleep apnea in any articles anywhere, you know, related to him, but I could almost guarantee that it played a role. And, you know, that's the thing. I mean, that's what you should be afraid of, because whether you realize it or not, everybody here listening has had a friend or family member or relative impacted by this, you know, and if not yourselves. I mean, I talked to a doctor today who had one of our sleep educators came to his office a couple weeks ago and did a sleep test on him, not expecting anything. And he was, they sent me the study and they wanted me to go over it with him because it was really, really bad. I mean, he's in a lot of trouble. And he had no idea until we did that. So a lot of yourselves, even, you'd be surprised. That's the first people you should treat. The first people you should put through the program in your practice is everybody that works for you, everybody's spouse that works for you, right?
Yeah.
Including yourselves, brothers, sisters, parents, immediate family member. You've got a dozen cases sitting right there, easy, right in front of you, of the people that you love and care about the most that need this. And what better way to create a walking billboard for what you do than if you took your hygienist husband, who's been snoring like a freight train, and she's worried about all this stuff that's happening, and now you made an appliance, and now they're back in the same bedroom again, and he's got energy to play with the kids, and he can wake up in the morning and not feel like he got hit by a truck. And what better advocate could you possibly create in your own practice to go talk to other patients about this than by doing that? And so we always advocate for that.
Yeah, it is a much more rewarding conversation, honestly, to talk about
Right?
sleep than cavities, for instance, because I don't know, it seems to hit home a little bit more, and they seem to be a little bit more engaged in that conversation. But you brought up a really good point about reading a sleep study with someone. I never really appreciated the value of that until I started doing sleep medicine in our practice, and sitting down and reading a sleep study with a patient. First off, not all sleep physicians are the same, but at least the ones that are close to me don't review these with patients. They just put it in their, their ER, my chart, whatever. Yes, you have sleep apnea. No, you don't have sleep apnea. And that's pretty much it.
Yeah.
So then they show up to me because they don't want to do a CPAP or whatever. And we're going to have the conversation about what to do. And so I say, well, bring me your sleep study. Let's just go over it. Let's look at it. And I look at, wow, you don't breathe that long. Do you know if you were in the hospital for this long with this kind of saturation, they would shove a tube down your throat? And then they're like, what, really? And I said, your heart rate, were you on a treadmill while you were sleeping? Really? And so all of a sudden, all these pieces are starting to come together. Like, that's really happening while I think I'm sleeping. And I said, it's no wonder you feel like crap, honestly. And I know we said this isn't a stereotype disease, but how do we ever hope that folks who are overweight and don't feel good are ever going to get back on that horse of getting better and taking care of themselves and, exercising and feeling energy to do any of that stuff? It's that perpetual hamster wheel they're on, where if they do get overweight and sleep apnea does happen to become a part of that negative downward spiral, they then don't have the energy to get back on the horse and start working out and eating right. And it just sort of feeds this really terrible downward situation. And so for patients that we have that conversation, I say, this is a step you need to actually start feeling like you want to make a life change before you do any of the other stuff that you're doing. Sleeping better is going to be that like tipping point for you, that you're going to want to get on that treadmill, or I don't know, eat, a salad that day, or whatever it happens to be that you need to do, because you're finally going to be energized to want to do that and to give a shit about yourself, because when you don't sleep, you just don't. And that seems to really resonate with folks. So that gets them motivated to want to at least pursue. And again, honestly, I refer out as many patients as I treat just to go get treatment, because I just want them to get better.
Right.
I would have to close if I were just a dental sleep doctor. I don't have enough patients for that. So please understand, I don't come from any high horse of like, oh, you should be doing 1,000 cases a year and dental sleep medicine is the most profitable thing I've ever done. It's just been such a rewarding piece to add into my dental practice, and a big part of just comprehensive care for me.
That's perfect. I love that. And what you said about this kind of perpetual, this downward spiral, the hamster wheel, that is so true. And and also what you said about the sleep studies and not.
Is that for
So
everybody or just where
it's
I
everybody.
live?
It's everyone. There are so many patients out there that are diagnosed with sleep apnea. And if you ask them, what is sleep apnea? They can't tell you. They can't tell you accurately. Maybe the educated ones went online and figured it out,
Yeah.
and Dr. Google diagnosed them, but their sleep physician often really plays a very, very small role in explaining and educating. And I think that's a real shame because, there's an opportunity here.
Mhm.
This isn't a joke, right? I mean, at the end of the day, I got all this bad stuff on the screen, right? All these things that could happen to you. But, at the end of the day, if you don't take care of this takes years off your life, 12 to 15 years off your life. That's a lot. That's worse for you than diabetes. It's worse for you than smoking. It's, it's a serious thing. Not only does it take those years off, but then it gets to the point that you were making of what kind of quality the years that you do have left, not the ones that are cut short, but the ones you have left, what kind of quality of life do you have? You're exhausted, you're chronically fatigued. You can't get out of your own way in the morning. You're falling asleep at work. You're falling asleep driving your car. You don't have energy to go play with your kids or your grandkids or whatever. And it's just this bad life cycle that, this propagates obesity and a pattern of, consuming a huge amount of carbs just to stay awake. And it's this bad cycle. And there's a way to break it. You got to stop the disease. And it's kind of an off ramp to that for a lot of people. And
one of the things that people don't talk about enough either is the value of sleep. Yes, we can focus in on its contributions for heart disease and diabetes and all that, but it's the reparative piece too that I don't think we give enough credit to, right? So if our body's not going into those deep sleep cycles and really getting that reparative time, that's when our brains get fixed a little bit, from bad memories or traumatic issues. That's when cancers get degraded by other immune cells. I mean, that's when the body's doing all its toxicity
cleansing. Yep.
Exactly. And it's clutter clean. If we don't give it that time, then the body never really deals with a lot of the junk that's sort of hanging out in there as well. And so we have the direct corollaries, which are very obvious. If we have heart issues, strokes, those types of things, you can obviously usually attach those to if there's sleep apneic events. And we can systematically understand why that would be unhealthy. But then there's all these other really important functions that our body needs to do at night. And you want to get someone whose perio gets better or whose, caries risk goes down. They need reparative times for all of those immune complexes that are happening in their body. So it's not just protection of their heart and, and their brain and all the things that we can, and behavior mechanisms, which we can directly attach to sleep apnea. There's so many other things we probably really don't even understand about the value of what real reparative sleep looks like and its contribution to overall wellness and longevity.
Mm-hmm.
Especially since I host a hump day happy hour every Wednesday, I really need that reparative time to detox all the crap that's in my body. So it's just water, just so we're on the same page.
I was going to say the same thing when I took a drink of water. If Jeff was on and Chad, it wouldn't be water.
It wouldn't be.
No.
We'd done switched by now.
Right. Well, what else is there to talk about? I see, I'm just pulling up the chat here, actually.
Yeah.
Nicole said that her father's CPAP intolerant. This is hitting home big time. So that's cool. That's good. I hope it does. I hope it can lead to a good conversation with Dad about what to do. And if you need help as far as a direction there, I don't know where you're at or your dad, but we can certainly point him in the right direction to help and get a sleep test, or in his case, he doesn't need a sleep test. He's already CPAP intolerant. So he's, that's in the dental sleep medicine world, that's the low hanging fruit, right? That's the person who's been diagnosed already. They are intolerant and refusing the most, the kind of gold standard therapy. he's ready for an appliance. We could have him in for records tomorrow. I mean,
Yeah.
that's ready to go.
And for doctors that are just looking for just, you know, if I want to start tomorrow just to see what even your patient population looks like, just making sure their health history has a few key questions about sleep on there. It doesn't have to, I mean, you could go all in on a whole sleep questionnaire and really dial in on that, but you honestly could just add a couple questions about, do you snore at night, or does your bed partner report that you snore? Do you know if you have sleep apnea, and do you feel like you get rested sleep? There's some very simple questions you could add to your questionnaire. If patients don't fill it out, they haven't opened that window for conversation. But if they do, they've opened the window at least up for you to have an easy talk about that. And especially if they validated on their health history intake, and then you see other clinical signs, you know, of scalloped tongue or airway constriction, giant, you know, tonsillar masses in the back, anything that might have triggered, you know, you in your exam as well to think that that might be happening. You know, adding just a few simple questions to your health history really opens up a very easy question. And to your point with the CPAP intolerance, what's so frustrating, not for me as a clinician, I think as a family member, is to have folks who have accepted CPAP intolerance, number one, as the end of that journey of treatment, and that it's just something they're going to live with. That you know, I have sleep apnea, but it's just something I've had to accept. And you know, for some folks, especially in that moderate to severe category, that is not sustainable with life for the length of time you'd like to have. So, but it's, you know, it's such a slow degradation, people don't realize what it's really doing for them. So if you're looking for an easy way to at least see what your patient population looks like and how you might start to have those early conversations about sleep, just adding a few questions to your health history is a great way to start screening patients to see if that's the next step you want to take in your education.
That'll be, if you go to the link that I have on the screen now, or you can scan the QR code, it'll take you there as well. If you go to that page, we have some information there, but also submit your info, and one of our sleep consultants will reach out and just kind of discuss your options and what's the best path for you and your team to get started with this. And it's always, doesn't really matter what you need to do. It's always going to start with what Jennifer just said, which is just the you know, the basic patient screening, the healthy conversations, talking about sleep and breathing and snoring and that kind of stuff. And if you can start doing that, you'd be surprised what happens. Just the snoring conversation alone. I like what you said about pairing it back to something you saw, so it doesn't seem so weird and out of place, right? Oh, yeah. I saw the scalloped tongue, right? So, hey, this is something we see all the time in our patients with sleep disordered breathing. Tell me, has anybody told you occasionally snore, right? And now go down that path of having a conversation there. And what's great about that is they're either going to admit to it or they're going to accuse somebody. Those are the only two options. They don't just say no, right? It's either no, I don't, but you got to hear my husband. He snores like a monster.
Yeah, exactly.
Or, yeah, I
never
do.
me.
You know? Right. It's one of the two. It's never just a straight up no. So those are all good conversations to have. And, you know, it starts building a list of people to follow up with. Like I said, if we just went in your office tomorrow and we gave home sleep tests out to everybody, we would find 2 or 3 or 4 diagnosable sleep apnea patients. So it's not that hard to find. You know, a good conversation will get you there, or get you a good portion of the way there.
I agree.
Well, it's 8:45. I usually try to go for like, I see some questions in the chat about certificates. So for yes, you'll get a CE certificate. They'll be issued and sent out via email. So you'll get that information as a follow-up, as long as you were registered in here to the course, which you were. And for those of you that are watching on Facebook and all the different groups this is live on now, again, use the links that are on the screen to follow up, and you know, we'll be in touch, and we can coordinate with you and get at least a conversation started and get some screening started with your patients. If nothing else, that's a really good first step.
I'm laughing about the identity of a scalloped tongue. Again, this is really just as good for those of us who are in this world as, our patients that are coming in. We're often the ones that aren't being treated.
Yeah.
And I think you bring up a really good point too. A great entry point to starting the treatment modalities is guaranteed either your family members or your team members or their spouses have sleep apnea. So, it's easy to dip your toe, start working on your role playing a little bit. How are you going to have these conversations and engage patients about sleep apnea? If you want to use technology like the pharyngometry and rhinometry, how are you going to start implementing that in practice using those tools, making devices, and then, ultimately delivering, titrating, and getting those patients comfortable. Often you're offering it at a very reduced cost to do it, but it gives you an opportunity to start working through that flow with both your team as well as yourself so that you feel more confident after you've seen a few cases.
I think that's good advice. Hopefully everybody wants to jump on and help some people, right? Let's make a difference. Let's not do everything the same tomorrow that we did today.
Yep.
If we can make that change, have one conversation. That's our first goal, right? That one sleep health conversation talking about snoring or airway or whatever. And it's going to be uncomfortable and weird, but that's all right. You'll do well. But if you don't do anything different, then you're not going to get a different result. And the people are there. They need your help.
Well, and let me just extend, Jeff and I are both a part of a group outside of SGS called Dentists in the Know. This is not a plug for them, but
okay,
we are responding and watching those posts all the time. So,
yes.
You're not doing this alone. There's a lot of qualified folks that are participating that have gone through all the difficulties. Jeff is running a full sleep practice with a sleep health coordinator and doing he's at that level of the sleep game. I'm doing, a very general practice level sleep dentistry. And there's a lot of folks somewhere in between. Finding those mentor resources, whether it's through vendor relationships and educational partners like Sleep Group Solutions, or, using these forums, we're there, we're available. And, most of us are, very willing to mentor and educate folks through those onboarding processes to get them comfortable, because we are very passionate about providing that service to other communities. So, and there's no charge for that. You just hang out and ask questions all day long.
I think that's excellent advice.
Jeff's gonna love I volunteered him for it.
Yeah, so here, we're going to give out Jeff Horowitz's cell phone
number. Hold on, let me get it. He'll be happy to answer any of your questions.
I've put him on the spot many times where people, have reached out and asked questions, and he's we give him a hard time here, but he's been more than willing to help, and for sure in these the Facebook group and the Dinks group. I mean, it's a forum, right? It's a community of like-minded dental folks that, you can share your questions, concerns. Hey, I got a weird case, or this happened. What do I do? If it's related to this or anything else, really, but
absolutely,
but specific for sleep, I'm in there. We'll for sure help.
Absolutely. That's the cool thing, is because it's a group where we aren't just exclusive to doctors. We have our educational partners helping us with those questions as well. So I don't always know the answers, but there are people in just about every industry, even insurance, devils are hanging around in there because they actually know a lot about the specific industries they represent. And so who better to lean in on and kind of get that cohesive relationship going. I was talking to somebody the other day about vendor relationships, and we can't get into the schools. There are some vendors that can't get in because they won't let them in because of all, they're trying to lock up their dental students so they're not influenced. And I thought, that's so ignorant, because as a doctor, I'm so dependent on my vendors. Like, I can safely say I would have never been successful at sleep medicine had it not been for my relationship with SGS, because you had a very good program dialed in on taking a new sleep doctor and getting them trained and ready to run a sleep patient through their practice. Had I been fearful of a relationship with a vendor and not comfortable with what, you know, that community looks like, I would have missed out on that great opportunity. So I think, you know, educational partners are so critical for doctors and their success in their practice. And yes, you do have to make a dollar, but so do we. And the better we make that dollar in an educational format, the better we both are. So
exactly. Well, what's everybody think? I think it's about time we can close it down. I just want to thank everybody for joining and staying on. Actually, the number of participants grew throughout this, so that means we're saying the right stuff. We didn't offend anybody, which is cool. That's rare, so that's good.
Watch Wednesday's Hump Day Happy Hour. We offend someone every time.
Of course, that's the best part. So, but no, that's tomorrow night. So we'll be on. I'll be on. I'll be watching. And you know, thank everyone for joining. Thank you very, very much, Dr. Bell, for your time tonight and sharing with everybody. I think it's great info. It's a cool story. It's not impossible, right? There really is an approachable, easy, you know, path here. You just got to take that step. Don't be afraid. You know, take that leap. Do something small tomorrow. And if we could take away that, I think that's the best advice we can give.